let's discuss ABGs and then how to interpret ABGs. ABGs here is talking about arterial blood gases. A for arterial, B for blood, C for gases. So this is an evaluation that is done to assess the oxygenation, acid-base balances, and ventilation of a person. And then we have certain components in ABG interpretation. So we have a blood pH of the blood. We have partial pressure of carbon dioxide. We have partial pressure of oxygen. Then we have bicarbonate levels. And we should know the normal values of these components before we go on. So let's start with the pH. So normal value of the blood pH is 7.35 to 7.45, and if pH is less than the 7.35, it's acidosis. If it is more than 7.45, it's alkalosis. Then we have carbon dioxide, the partial pressure of carbon dioxide. The normal value is 35 to 45. I'm right there. 35 to 45. So less than 35 is alkalosis. More than 45 is what? Acidosis. Carbon dioxide, acidic. Yes. Then we have bicarbonate, alkaline. So bicarbonate normal value is 22 to 26. So I just said bicarbonate, alkaline. So higher bicarbonate is what? Alkalosis. Lower bicarbonate is acidosis. So 22 to 26, less than 22 is what? Acidosis. More than 26 is what? Alkalosis. But now when a lab value is given with all this, how are you able to know that it is respiratory acidosis, it is metabolic acidosis or alkalosis? First, we have to find out whether it is respiratory or a metabolic issue. If the signs and symptoms of the patient is given to you, it can be easier. If patient is hyperventilating or hypoventilating, it will help you to know that there's a respiratory issue. So it's either going to be respiratory acidosis or alkalosis. If patient is having excessive diarrhea or vomiting, or is having kidney disease or gastric lavage, you know that this is a metabolic case. So it's going to be either metabolic acidosis or alkalosis. That is, your signs and symptoms can be a guide for you. So now let's start with respiratory. So hypoventilation, if a patient is hypoventilating, the person is going to retain a lot of carbon dioxide, and we said carbon dioxide is what? Acid is. So acidic. Hypoventilation will let the person is likely going to have respiratory acidosis. If the person is hyperventilating, the person is going to bring out a lot of the acid out, and there's going to be respiratory alkalosis. So conditions that can make somebody hypoventilate include COPD, chronic obstructive and pulmonary diseases. COPD clients usually hypoventilate, so they are likely going to get what? Respiratory acidosis. Airway obstruction, anything that obstructs somebody airway, the person will hypoventilate. Then depression is another thing that can let somebody hypoventilate. And when somebody have respiratory acidosis, the pH is going to be low acidosis. Carbon dioxide, partial pressure of carbon dioxide is going to be high, that is more than 45. And then the bicarbonate is either going to be normal or is going to be high. Now, respiratory alkalosis, conditions that can make somebody get respiratory alkalosis. We mentioned hyperventilation. So a situation that somebody will hyperventilate, anxiety is one. Severe pain is one of it, and then fever can let somebody hyperventilate. And when somebody is hyperventilating, as I said, a lot of carbon dioxide is going to come out. We said it's acid, so acid is coming out, leaving non-acid, so it's going to be respiratory alkalosis. And it means that pH of this person is going to be high, more than 7.45. Partial pressure of carbon dioxide is going to be what? Low. And then bicarbonate level is either going to be normal or what? But all these are usually sometimes very confusing. Yes, sometimes we are not able to, like, it's just cumbersome and then confusing sometimes. So there is this trick that if you get a question that is talking about ABGs and they want to know whether it's a metabolic acidosis or metabolic alkalosis, first thing you should be looking for is either whether it is a respiratory issue or a metabolic issue. If only the figures is given to you, but probably signs and symptoms are not added, or the signs and symptoms you are not able to deduct from your signs and symptoms whether it is a respiratory issue or a metabolic issue, look at the figures that is given to you and compare the pH value to that of bicarbonate value. If pH value is going in the same direction with bicarbonate, it is a metabolic issue. We said bicarbonate is associated with what? Metabolic. Carbon dioxide is associated with what? Respiratory. So for instance, you've been given a question and then pH is low, metabolic is bicarbonate is what? Low. It is a metabolic issue. Just know that fast forward is a metabolic issue before you now go further on to assess whether it's acidosis or alkalosis. It's a metabolic issue. And once bicarbonate is low, we said bicarbonate metabolic. Low bicarbonate is what? Low base. It means it's going to be acidosis. And pH is already low, so acidosis. So this is just definitely what's the name? Metabolic acidosis. So if you are given a question to and pH is what? High, and bicarbonate is what? High, you know that this is a metabolic issue because pH and bicarbonate are all high. So pH high, alkalosis, bicarbonate high, alkalosis, hence metabolic alkalosis. But if a situation where pH is high and bicarbonate is low, this question or this person is not in any metabolic state. Go back and look at your carbon dioxide. The person is in a respiratory. So if pH is high and carbon dioxide is high, pH high alkalosis, carbon dioxide level is low, it means alkalosis. So it's going to be respiratory alkalosis. So in my next video, I'm going to bring some questions and then we can see whether we can solve them. But let's also look at metabolic. We talked about respiratory acidosis and alkalosis, their causes. Let's talk about metabolic acidosis and alkalosis. What could cause? So with metabolic acidosis, diabetes ketoacidosis can lead to metabolic acidosis. Severe diarrhea can lead to metabolic acidosis. And then renal failure can also lead to metabolic acidosis. Then metabolic alkalosis, vomiting can lead to metabolic alkalosis. The person is vomiting stomach contents, so stomach acid is coming out. Certain diuretic use can lead to metabolic acidosis. Metabolic alkalosis, what could cause metabolic alkalosis? Vomiting, use of diuretics can cause metabolic acidosis, and then intake of bicarbonate. So excessive intake of bicarbonate can also cause metabolic alkalosis.